to look back on 20 great years of OBSSR. As I think a lot of you know, maybe some of you who are not NIHers don't realize, that we have a bit of a matrix organization at NIH. There are the 27 institutes and centers, and then there are these offices that cross those columns and provide the coordination and sometimes the innovation that all of us can gain from. And Bill had asked me to take just a moment to say what that means for NIMH, which is an institute that's had classically a lot of investment and interest in behavioral and social science research. And for us, this remains very much a priority. We've just come out with a new strategic plan. And if you look at that plan, which is easy enough to find on our website, there really are just 4 goals to it. One is to be able to explain the mechanisms of complex behavior. The second is to begin to map the trajectories of development of normal and abnormal behavior. And the third goal is to create new interventions as preventive and treatment strategies. And finally, to make all of this have some public health impact. But inherent in every part of that plan across all 4 of those goals is this great interest in looking at both behavioral and social science research and making sure that it serves the needs of people with serious mental illness. And so OBSSR has been a great partner for us in the past, and I'm sure will continue to be an important partner for us going forward for the next 20 years at least. So happy birthday, and we look forward to continuing to work together. I had decided when being invited to moderate this session that I would be happy to do it. And then when I saw the speakers who had been invited, and I had no role in inviting these 2 people, I was simply ecstatic, because I think you're in for a great treat. You're about to hear from 2 really extraordinary scientists, very different in what they do, and yet, as I think you'll begin to realize in listening to them, there's a fascinating kind of thread that pulls them together. So in contrast to what Henry just talked about, which is really a focus on motor behavior and motor guidance and the basal ganglia, what we're going to move into now is a discussion about cognition and affect, and a really interesting way in which they can be strung together at the level of family systems and how children are affected by having parents with affective illness, and then, as you'll hear from our second speaker, something about how the most fundamental aspects of affect get instantiated into brain systems that can then be manipulated. A really interesting set of stories we'll hear about. So the first speaker, and I'm going to be brief mostly to give us the maximum time to hear from our speakers. The first one is Ian Gottlieb. I think what we'll do is hear from both speakers and then invite questions and discussion thereafter. So I'll do the introductions for both now, and they'll come up in sequence. Ian is the director of the Stanford Mood and Anxiety Disorders Lab at Stanford University. He has a long history of science in the areas of understanding the development of children of parents with affective illness, but more recently has been working on a set of interventions, which I hope he's going to talk to us about, in which looking at affective bias and how that can be manipulated in the service of changing the trajectory and actually getting a very different kind of outcome. So in line with what I described as the goals of our strategic plan, it would be hard to find anybody who's more aligned with what we're trying to do at NIMH. Our second speaker is Steve Ramirez, recently minted PhD. I hope I'm saying that right. The last time I saw Steve a few months ago was pre-PhD, but are we through this process now? It's a long story. So maybe we'll hear part of that now. Steve is a Harvard Junior Fellow and a scientist in Susumu Tanagawa's lab at MIT. His work has received an enormous amount of attention recently. I had the great pleasure of giving him an award at the Smithsonian Ingenuity event a few months back for the work that he's done on manipulating so-called engram neurons, individual neurons in the brain, using optogenetics to be able to change memories, either to erase memories, instill memories, take good memories and turn them into bad memories, and happily take bad memories and turn them into very good memories. So all this, by the way, is being done in mice, not people, but you'll hear from Steve some of the promise of this kind of work. So let's start with Ian. We'll move on to Steve, and then hopefully we can leave some time for discussion. I think there'll be a lot of interest in both presentations, and the challenge for all of you in the audience is to pull all this together in an integrated OBSSR fashion. Ian.
Thank you so much.